Hi, I'm Dr. Jamison Spencer. Today I'm going to show you how to use the George gauge bite gauge when fitting the silent sleeve. This is the George gauge. The George gauge has several different parts to it and has bite forks that come with the George gauge and that are used to take your bite registration. The bite forks come in a 2mm vertical and a 5mm vertical marked with either a 2 or a 5. The vertical is determined with the bite fork in place, and then the space in between the grooves for the incisors makes our vertical. So that is about 2mm of vertical opening there. With the white fork in, it is 5mm. How the George gauge works is the patient puts their incisors into the grooves. The lower can be changed by unscrewing this here, and then this can move to accommodate for the width of the incisors, the lower incisors, and then the upper incisors go in that groove. Let's go ahead and show how that works. So if I wanted to use the lower vertical George gauge to take a bite record, I would take this to the patient. Sometimes it's easier to just take that off to do the lower incisors, and that is plenty of room there. So this should fit easily over the lower incisors and not have a lot of extra space. I then add the upper, and we're going to leave this so it has a little bit of ability to move back and forth so that we can measure the range of motion. Okay, so I'm going to put that in the mouth, close, and she's going to easily go into that upper slot. There is a line right on the middle of the upper bite fork that is meant to be on the midline. So we line that up with the dental midline. Then we're going to check range of motion. So Jenny, bring your jaw back as far as you can. When she brings her jaw back, if we can show this Blake on here, it is going to have these marks. Can you see that okay? Mm-hmm. Okay. So the marks on here right now, it is at -5mm as she takes her jaw back. Okay, now go ahead and push your jaw forward as far as you can. And we see that go clear to 6, 7, 8 to the positive. Let's do that again. Go back, take your jaw back, and it's 5, basically -6 is that mark. And now take your jaw forward as far as you can, which that time she did +8. Okay, and just relax. So she went to -6 and to +8, so that's 14mm in between her farthest forward position and her farthest back position. Where we usually want the bite registration to be is somewhere in the 60 to 70% of maximum range of motion or maximum protrusion. So since she had 14mm, do some quick math here, that's about 9 to 10mm forward that we want to be for her to be in that 60 to 70% range. So if we go back from 8, that would be at about +2 would give us that range. So if I take this out of her mouth, open, bring it up to +2, and so remember she went all the way to +6 at her maximum, so I take that about +2 +3 for my 70%-ish, which takes her a little past end to end. Actually, excuse me, take that. It's going to be +1, 2, and 3, +3 right there. Here's where the mandibular teeth will be, the maxillary teeth right there. Open, close. Okay, and that takes her a little bit past end to end. So that'd be the position that we would take a bite registration in for any type of sleep appliance when open. So how that's done is you would squirt your bite registration material on the fork, open, with that on, close, and that would then set with it on the fork. Once it's set, open, we can then just unscrew this and take it off, and this will actually then break off if you want to, and you send that to the lab for fabrication of the oral appliance. Okay, now let's show how we use this with the silent sleep now. So if I put this back, I have a couple of bite forks that have been modified. Obviously the fork portion has been broken off. we don't need that fork portion on there for fitting in the silent sleep. So if we're again going to use the 2 millimeter vertical, I would just bring that in here like this. And let's say we want to put the patient at end to end. We just dial that in at end to end. You see also that I've modified this slightly to make it more open for the maxillary incisor to fit in more easily. So I've just ground that out a little bit to make sure that the incisor can go all the way to the bottom of that groove. Okay, so now to bring that to the patient's mouth. Again, I've decided in advance that I want to use end to end, or we're going to try that position. So open and close, and we ask the patient, how does that feel?
Good.
Feels okay. Okay, open. Maybe we try a more forward position, so we would go plus a couple millimeters, which is going to bring the lower jaw forward a little bit. Close. Okay, how does that feel?
That feels okay too.
Feels okay too. So we have now +2. Now the nice thing with this gauge also is we can communicate to each other, to the laboratory, and we would put this in the chart that we were starting the patient at +2, or in the case of end to end, we go to 0, which would be a George gauge of 0 is our initial starting point. Okay. With that, with the silent sleep then, we would fill the tray in the normal manner, have the patient open with the tray in their mouth, and close down, and they are going to, then we would have the silent sleep fit in the mouth with that positioning of the George gauge. If we needed to then change the position down the road, open, we just simply come back and decide to go forward 2 more millimeters, and then we would refit the appliance in the +2 position, +4, +3, whatever. Easy to do with the George gauge, and this portion can be reused, so this can be cold sterilized and then used for many, many patients. That's how you use the George gauge to either take a bite registration for a sleep appliance or to use it to fit the silent sleep.